Hello, I'm Dr. Sanjay Singh Negi. I am the Director and Head of Liver Transplantation Surgery at BLK Super Speciality Hospital, New Delhi. The Liver Transplantation Surgery Department at BLK Super Speciality Hospital is a state-of-the-art facility with all the supportive departments including intensive care, anesthesia, interventional radiology, gastroenterology, hepatology, as well as all the support services like nursing as well as physiotherapy services, is one of the centers which is at par with the best centers in the world. The department has dedicated ultra clean ventilated operation theaters and has also got state-of-the-art ultra clean ventilated intensive care isolation cubicles in which we keep our post-operative patients and donors. The team comprises of surgeons, anesthetists and intensivists as well as paraclinical staff who supports the donor and the patients in the post-operative period as well as the pre-operative optimization period. Liver is a unique organ in the body that performs more than 500 different functions. Talking in simplistic terms, liver acts as the engine of the body, wherein it is also known as the powerhouse of the body. It gives the energy to the body, wherein it metabolizes or burns all the various nutrients and calories that we consume in our day-to-day life. Besides, liver also acts as a factory, wherein it produces various products, various chemicals, various factors, as well as vitamins which are required by the body for its day-to-day functioning. For instance, liver produces proteins, especially albumin. Liver produces bilirubin as well as bile salts, which helps in digestion of the food that we take. Liver also helps in manufacturing the various clotting factors which are very much required for the clotting of the blood. Otherwise, if such clotting factors are not produced by the liver, then the patient or the individual can bleed to death even after a minor injury. Besides, liver also acts as a huge immunological organ in the sense that anything that we consume, including the various bacteria and viruses that we're talking about, they are absorbed into the blood and they go through the filtration system of the liver, wherein all the toxins as well as all the bacteria and all the viruses, they are killed or neutralized by the liver. So liver acts as a filter as well by its immunological and filtrative functions. Liver is a very forgiving organ in the sense that it is an organ that performs a huge number of tasks and it never asks for respite from an individual. We keep on abusing our liver. We keep on consuming so many toxins, so many poisons. We tend to eat junk food and all these junk food are finally kind of burnt in the liver itself. So there is additional burden on the liver as such. The liver in turn has got huge regenerative capability, or it has a unique property of regrowing after any kind of injury. But when the injury is massive, or if the injury is ongoing, or if we keep on abusing our liver over a long period of time, then the liver fails. Obviously, we should take care of such a beautiful organ, and the onus is on us to take care of this special organ. We can take care of our liver by not consuming junk food, by exercising regularly, by going in for periodic checkup with a physician, or if there are any signs and symptoms which are indicative of a liver disease per se, then we should go to a physician or a doctor. In this context, I want to point out that the liver does not produce any signs and symptoms of any disease unless more than 80% of it is damaged. So by the time the signs and symptoms of the disease actually appear, at least 80% of the liver is already damaged. So rather than wasting time, the moment you get any signs and symptoms like jaundice or vomiting or not having appetite, or you're throwing up, or there's collection of water in the tummy, or if somebody starts vomiting blood, or if or somebody starts losing consciousness, then these patient should immediately consult a specialist doctor. Besides, for hepatitis B, there is a very good preventive measure in the form of hepatitis B vaccination. And it is recommended that not just children, each and every individual should get themselves vaccinated. And it is not just to get the shot of vaccine, but also confirm that the body has developed immunity against hepatitis B. So once you have completed the course of hepatitis B vaccine, the person should go to the doctor again and get his blood tested with regards to antibody titer for hepatitis B. Liver transplantation procedure is a major decision for any individual and a family, and it essentially involves three important facets. One is the patient, other is the donor, and third is the finances. All these three facets needs to be taken into consideration when a decision about liver transplantation is taken. With regards to the patient, the most important thing is the risk benefit ratio of liver transplantation, जिसको कि हम आम भाषा में बोलते हैं कि नफा नुकसान. The patient should be benefited out of liver transplantation. That means the benefit should be more and the risk should be relatively less. The other facet is the donor. When we are talking about liver transplantation, we remove the old diseased liver from the patient and we replace it with a new liver. Now this new liver has to come from somewhere. Obviously, the best source of this new donor, of this new liver, is from a brain dead donor wherein a person has been declared brain dead medically. This kind of procedure, which is conventionally known as cadaveric liver transplantation, is the best because it gives you the whole liver and it is not associated with any donor risk. However, because of various social, cultural taboos and dogmas existing within our society as such, the donation of organs by individuals is by and large very rare. Hence, we have to fall back upon the second source of the new liver, which is the living donor liver transplantation, wherein a close family member of the patient decides to donate a part of his liver willingly to the patient. The third facet that I talked about is the money. Liver transplantation is a complex surgical procedure, and obviously the patient and the family have to arrange for the money for not just for the procedure but also for their stay if the patient is coming from overseas, and also they need to basically save or separate an amount for the future of the patient, wherein the patient requires periodic checkups and needs to take certain medication which we call immunosuppressive medication on a lifelong basis. More than 90% of the patients can be discharged from the hospital in around 3 weeks' time. This stay in the hospital is decided by the pre-operative condition of the patient or how sick the patient was before the operation. If the patient is otherwise fine, we discharge such patients even within 2 weeks following operation. Once they are discharged from the hospital, they are as good as normal. Barring the fact that they have to come to the hospital, they have to visit us on a regular basis, which is protocol based, and they have to take certain medications, and one medication like immunosuppressant they have to take on a lifelong basis. The only precaution that the patient has to take is that they have to come for regular checkup, they have to take the medication as prescribed, and they have to take certain precautions with regard to cleanliness and the food that they are eating. They cannot, like in a normal individual, if they develop say normal viral fever or a viral common cold, they can take it, they can take it easily, they can take it lightly. They can perhaps have a few crocin tablets and they can go for their regular activities. But a liver transplant patient is an immunocompromised patient wherein we have suppressed their immunity. They cannot take any infection lightly, and for every infection or every ailment that they have that they basically encountered in their later lives, they have to consult a suitable doctor. Also, they have to avoid lifting heavy weights for 3 months, and after that they are as good as any other person of their age group who has not undergone liver transplantation procedure. That means that they are as good as normal. With regards to donor, if all goes well, then we discharge the donors after a week following operation, and then the only precaution that they have to observe is avoid lifting heavy weights for further 3 months. There is no medication that needs to be taken by the donor on a long-term basis. Once we discharge the donor from the hospital, then they are no more on any active medication per se, and they are as good as any other normal individual. To know more, please subscribe to our YouTube channel. Thank you.
BLK Super Speciality Hospital, a passion for healing.